Well, in the last 5 years, radiology within Golden Jubilee has seen massive expansion. So much so that not only have the radiology team numbers expanded, but the amount of equipment that we have in general has. So now we've got 4 MRI scanners, 2 CT scanners, 3 ultrasound rooms, 3 plain film rooms, and as of this year, 5 cath labs as well.
So in general radiology, we cover inpatients and outpatients. So the inpatients would be patients in the wards, and we either go to them or they come down to us. And the outpatients is predominantly clinics. Radiographers predominantly, unless they're core to one area, would rotate through the general department, and they also do on-calls overnight for general. So there's always a radiographer 24/7.
So at the minute we have 2 CT scanners. The vast majority of work is waiting time patients from various different health boards across the west of Scotland. We also provide scanning services for SPBU, SNAFs, and we provide a lot of cardiac scanning as well.
Previously, just prior to COVID, we then suddenly had our work almost dry up. We're now working with sort of COVID targets set, and we're working up to 80% of what we've been set. Having said that, we're now able to open up our remaining third waiting time scanner as of today. So our targets will certainly be able to increase with that.
There was quite a lot of work between the office and the radiologist to try and prioritise patients that could feasibly wait for their scans and were sent back to base. We had 1 CT scanner that we kept running for our waiting times patients, our urgent scans, our emergency scans, and we had our other scanner which we used for the use of COVID positive patients.
To have 1 radiographer on at night time. And since COVID, we have got 2 people on, so it just means they can help each other with certain patients that may need full PPE, because now the equipment needs all cleaned down, as well as the donning and doffing takes a lot more time. So it also gives that bit of extra support for patients that may come for CT as well.
It was a very, very anxious time, and I do appreciate our workload decreased. But there was a heightened anxiety of dealing with COVID patients, and what we found on quite a few occasions, we had shielding outpatients who were coming in for staging scans, and when we scanned them, they had COVID positive findings on their lungs. It brought a whole new side to scanning, obviously donning and doffing full PPE for dealing with the ICU patients. None of us had ever experienced this before, and I think we dealt with it really well as a team.
We'll be pulling from CT to go to cath lab, but then you have to get somebody else from general to go into CT, etc. So it can be quite tricky.
Since we've been inviting more patients to come back into the department, we've had to physically distance a lot of the chairs in the waiting room. That safety is, uttermost priority. Within the room, we're using full PPE with visors, because we work very, very closely with our patients. We've got enhanced cleaning programmes ongoing. This does slow us down, but it's just essential. Patient safety is absolute priority in the department.
What we classify as urgent scanning, for staging scanning for cancer, these patients are in a very high shielding category. We were supposed to put in our Canon Aquilion 1 CT scanner in April, and we eventually, the implementation went ahead at the start of October, so we're now up and running with that. So it's a wide detector scanner, and it was bought predominantly for cardiac work, which is absolutely brilliant. So it has a 16 centimetre wide detector. In our previous scanners, we would scan the heart in 4 heartbeats. And because of this wide detector, we can now scan the heart in 1 heartbeat.
We're also training an existing sonographer in carotid Dopplers, and that started in September. So that's going to be resilience for the vascular service that we already provide.
They've actually been quite good. I think they feel quite safe, and we ask them, the COVID checklist is done, etc. on them when they come, and they also I think the big thing for the patients is they can't bring the relatives with them, whereas before they would have had a relative.
I mean, really the gist of it from me, I think, is the teamwork that's developed and how grateful we need to be towards staff and what they've managed, what they've done, how much further they've put themselves above and beyond, a lot of the time out with their comfort zone. And it's been lovely to see, because we've actually seen staff developing throughout this whole period, and it's been very, very difficult for a lot of people, and a lot of people have actually adapted and been able to support other people over and above the work that they're doing, just to be sort of good friends to people in the department. It's been wonderful to see how everybody's pulled together, and in a lot of ways I think it's brought the whole department together.